Welcome back to your trusted Nclex Mastery channel, where we train smart, not hard. In today's video, we're diving into 50 very critical Nclex case study questions that will test your clinical judgment, critical thinking, and ability to prioritize under pressure. Each question comes with options, answers, rationales, and strategies, designed to help you not just memorize, but truly understand why the right answer is right, and why the others are wrong. Watch carefully till the end because these are the kind of case study questions that make the difference between a pass and a fail on the real Nclex. Let's begin. Question 1. A 72-year-old female with a history of congestive heart failure, CHF, is admitted with shortness of breath, bilateral crackles, and 3+ pitting edema. Her BP is 160/95 mmHg, HR 108 BPM, and oxygen saturation is 89% on room air. Which physician order should the nurse implement first? A. Obtain daily weight. B. Administer 4-furosemide 40 mg stat. C. Restrict sodium intake to 2 g daily. D. Schedule echocardiogram. Answer: B. Administer 4-furosemide 40 mg stat. Rationale: the patient has acute pulmonary congestion. Immediate diuresis relieves fluid overload and improves oxygenation. Strategy: use the ABCs, airway, breathing, circulation, improve breathing first before diagnostic measures. Question 2. A 6-year-old with sickle cell crisis presents with severe leg pain, swollen joints, and low-grade fever. The nurse notes the child is dehydrated. Which nursing action is the priority? A. Apply ice packs to painful areas. B. Encourage oral fluids. C. Administer prescribed opioid analgesic. D. Provide passive range of motion. Answer: C. Administer prescribed opioid analgesic. Rationale: pain management is the first step in managing sickle crisis to prevent further vaso-occlusion. Strategy: follow pain, perfusion, prevention in sickle crisis care. Question 3. A patient with diabetes mellitus type 1 presents with abdominal pain, fruity breath, and deep rapid respirations. Lab results show glucose 540 mg per deciliter, pH 7.10, and ketones in urine. What is the nurse's initial intervention? A. Administer 4 insulin as prescribed. B. Administer sodium bicarbonate 4. C. Restrict fluids until blood sugar decreases. D. Give oral glucose. Answer: A. Administer 4 insulin as prescribed. Rationale: the patient is in diabetic ketoacidosis, DKA. Insulin is essential to reverse acidosis and hyperglycemia. Strategy: always rehydrate and give insulin in DKA, never give oral glucose. Question 4. A 55-year-old male admitted with chest pain suddenly becomes diaphoretic, pale, and unresponsive. The monitor shows ventricular fibrillation. What should the nurse do first? A. Start chest compressions immediately. B. Call the physician. C. Prepare for defibrillation. D. Administer oxygen at 4 liters per minute. Answer: A. Start chest compressions immediately. Rationale: in cardiac arrest, immediate CPR maintains circulation until defibrillation is ready. Strategy: use the CAB sequence, circulation airway breathing, in cardiac emergencies. Question 5. A 25-year-old woman, 34 weeks pregnant, reports severe right upper quadrant pain, blurred vision, and facial swelling. BP is 170/110 mmHg, urine shows +3 protein. Which order should the nurse anticipate? A. Administer 4 magnesium sulfate. B. Encourage ambulation. C. Administer tocolytic therapy. D. Provide a high-protein diet. Answer: A. Administer 4 magnesium sulfate. Rationale: the symptoms indicate preeclampsia, magnesium sulfate prevents eclamptic seizures. Strategy: monitor reflexes, urine output, respiratory rate during magnesium administration. Question 6. A 60-year-old patient with pneumonia is receiving 4 antibiotics. After the first dose, the patient develops wheezing, hypotension, and generalized rash. What is the priority nursing action? A. Notify the healthcare provider. B. Administer epinephrine IM. C. Check the 4 site for infiltration. D. Stop the 4 and run normal saline. Answer: B. Administer epinephrine IM. Rationale: signs of anaphylaxis require immediate epinephrine to prevent airway compromise. Strategy: stop the cause, treat the reaction, then notify provider. Question 7. A 45-year-old man with cirrhosis has confusion and flapping tremors, hysterexis. His ammonia level is 128 mol/L, normal 10 to 50. Which medication does the nurse anticipate administering? A. Spironolactone. B. Lactulose. C. Furosemide. D. Prednisone. Answer: B. Lactulose. Rationale: lactulose lowers ammonia by promoting its excretion through stool. Strategy: in hepatic encephalopathy, reduce ammonia and monitor mental status. Question 8. A patient with end-stage renal disease is scheduled for hemodialysis. Before dialysis, the nurse notes a BP of 8850 mmHg and HR 118 bpm. What should the nurse do? A. Proceed with dialysis as scheduled. B. Hold dialysis and notify nephrologist. C. Administer normal saline bolus and proceed. D. Give antihypertensive medication. Answer: B. Hold dialysis and notify nephrologist. Rationale: hypotension can worsen during dialysis, treatment should be delayed and reviewed by the provider. Strategy: always check BP, weight, and access site before dialysis. Question 9. A 5-year-old admitted with dehydration from severe diarrhea has capillary refill greater than 3 seconds and dry mucous membranes. Which 4 fluid is most appropriate? A. 0.9% normal saline. B. 5% dextrose in water. C. 0.45% saline. D. Lactated Ringer solution. Answer: D. Lactated Ringer solution. Rationale: LR replaces fluid and electrolytes lost from GI disturbances effectively. Strategy: for isotonic dehydration, give isotonic fluids, LR or NS. Question 10. A 70-year-old male with diabetes has a foot ulcer with foul odor, redness, and warmth extending to the ankle. Which nursing action is the priority? A. Obtain wound culture. B. Apply topical antibiotic. C. Clean wound with saline. D. Elevate the leg. Answer: A. Obtain wound culture. Rationale: identifying causative bacteria ensures correct antibiotic therapy. Strategy: always culture before giving antibiotics. Question 11. A 68-year-old client with a history of atrial fibrillation is on warfarin therapy. The nurse notes that the client has bleeding gums and numerous bruises on the arms. The most recent INR result is 6.5. What should the nurse do first? A. Administer vitamin K as prescribed. B. Hold the next dose of warfarin. C. Notify the healthcare provider immediately. D. Encourage increased intake of green leafy vegetables. Answer: C. Notify the healthcare provider immediately. Rationale: an INR of 6.5 indicates severe risk for bleeding. The provider must be notified for reversal therapy, vitamin K. Strategy: in anticoagulant therapy, any INR 5 is a critical value, stop, assess, and notify before further action. Question 12. A 9-year-old child with asthma arrives in the emergency department wheezing, with nasal flaring and intercostal retractions. Oxygen saturation is 86% despite nebulized bronchodilators. Which order should the nurse anticipate next? A. Administer 4 corticosteroids. B. Obtain a sputum culture. C. Start oral theophylline. D. Encourage slow deep breathing exercises. Answer: A. Administer 4 corticosteroids. Rationale: severe asthma unresponsive to bronchodilators requires corticosteroids to reduce airway inflammation and prevent respiratory failure. Strategy: in status asthmaticus, prioritize airway, oxygen, and anti-inflammatory therapy. Question 13. A 56-year-old diabetic patient presents with confusion, diaphoresis, tremors, and blood glucose of 42 mg per deciliter. What is the nurse's immediate action? A. Administer 1 mg glucagon IM. B. Give 4 ounces of orange juice. C. Start 5% dextrose for infusion. D. Notify the healthcare provider. Answer: B. Give 4 ounces of orange juice. Rationale: for a conscious hypoglycemic patient, fast-acting carbohydrates are the first treatment. Strategy: conscious equals oral glucose, unconscious equals glucagon or 4-dextrose. Question 14. A patient with acute pancreatitis is experiencing severe epigastric pain radiating to the back. The amylase and lipase levels are significantly elevated. Which nursing intervention is most appropriate? A. Provide clear liquids. B. Insert nasogastric tube for suction. C. Encourage ambulation. D. Administer acetaminophen for pain. Answer: B. Insert nasogastric tube for suction. Rationale: NG suction decreases pancreatic stimulation and relieves nausea and vomiting. Strategy: in acute pancreatitis, follow NPO, NG, and pain management to rest the pancreas. Question 15. A 75-year-old male admitted for hip fracture surgery suddenly develops shortness of breath, chest pain, and anxiety. O2 saturation drops to 82%. What is the most likely cause? A. Pulmonary embolism. B. Pneumothorax. C. Myocardial infarction. D. Fat embolism. Answer: D. Fat embolism. Rationale: fat embolism is a common complication after long bone fractures, presents with hypoxia, restlessness, and petechiae. Strategy: recognize the triad, respiratory distress, neurological symptoms, and petechial rash. Question 16. A patient receiving total parenteral nutrition, TPN, suddenly develops diaphoresis, confusion, and tachycardia during bag change. What should the nurse do first? A. Stop TPN and start D10W infusion. B. Recheck blood sugar. C. Call the physician. D. Document findings and monitor. Answer: A. Stop TPN and start D10W infusion. Rationale: sudden interruption of TPN can cause hypoglycemia. D10W prevents glucose drop. Strategy: always hang D10W if TPN is interrupted unexpectedly. Question 17. A 60-year-old female with chronic renal failure reports muscle weakness and cardiac palpitations. ECG shows tall peaked T waves. Which intervention should the nurse anticipate? A. Administer calcium gluconate 4. B. Encourage oral potassium intake. C. Restrict fluid intake. D. Prepare for dialysis. Answer: A. Administer calcium gluconate 4. Rationale: the patient shows signs of hyperkalemia. Calcium gluconate stabilizes cardiac membranes before potassium removal. Strategy: for hyperkalemia, remember, calcium insulin/glucose dialysis. Question 18. A 40-year-old male with a spinal cord injury develops a pounding headache, flushed face, and BP of 221/20 mmHg. What is the nurse's first action? A. Administer antihypertensive medication. B. Sit the patient upright. C. Increase 4 fluids. D. Notify the physician. Answer: B. Sit the patient upright. Rationale: this is autonomic dysreflexia. Sitting upright reduces intracranial pressure while identifying the trigger, usually bladder distension. Strategy: always position first before medications in autonomic dysreflexia. Question 19. A patient post-thyroidectomy reports tingling around the lips and fingertips. The nurse observes muscle twitching. What complication is suspected? A. Hypoglycemia. B. Hypocalcemia. C. Hyperkalemia. D. Metabolic alkalosis. Answer: B. Hypocalcemia. Rationale: removal of the thyroid may inadvertently remove parathyroid glands, causing low calcium and neuromuscular irritability. Strategy, always monitor calcium and airway after thyroid surgery. Question 20. A 28-year-old woman is admitted with pelvic inflammatory disease, PID. She reports severe lower abdominal pain, purulent vaginal discharge, and fever of 39 degrees Celsius. What is the nurse's highest priority? A. Administer broad-spectrum antibiotics. B. Provide warm compresses to the abdomen. C. Encourage increased fluid intake. D. Obtain vaginal cultures. Answer: A. Administer broad-spectrum antibiotics. Rationale: infection control is the immediate priority to prevent sepsis and infertility. Strategy: treat infection first, then provide comfort measures. Question 21. A 48-year-old male admitted for acute MI is receiving TPA. 30 minutes into infusion, he develops sudden severe headache, vomiting, and becomes drowsy. What is the nurse's immediate action? A. Stop the TPA infusion and call the physician. B. Administer oxygen and continue infusion. C. Lower the head of bed and obtain blood glucose. D. Apply ice packs to the head. Answer: A. Stop the TPA infusion and call the physician. Rationale: neurological changes suggest intracranial hemorrhage, stop fibrinolytic therapy immediately. Strategy: with thrombolytics, any neuro change equals stop infusion, notify provider, prepare for CT. Question 22. A 2-week-old neonate has jaundice, poor feeding, and total bilirubin 20 mg per deciliter. The pediatrician orders phototherapy. Which nursing intervention is essential during phototherapy? A. Keep the infant clothed to prevent hypothermia. B. Remove eye shields every 4 hours for feeding. C. Offer water between feedings. D. Monitor bilirubin levels and maintain hydration and temperature. Answer: D. Monitor bilirubin levels and maintain hydration and temperature. Rationale: phototherapy reduces bilirubin, monitoring levels and preventing dehydration/hypothermia are essential. Strategy: ensure eye protection, frequent feeds, temperature checks, and periodic bilirubin checks. Question 23. A 34-year-old with newly diagnosed HIV presents with fever, cough, and oral thrush. CD4 count is 90 cells/mm superscript 3. Which prophylactic therapy is most important to start? A. Isoniazid for TB prophylaxis. B. Trimethoprim sulfamethoxazole, TMPSMX, for PCP prophylaxis. C. Fluconazole for fungal prophylaxis. D. Azithromycin for MAC prophylaxis. Answer: B. Trimethoprim sulfamethoxazole, TMPSMX, for PCP prophylaxis. Rationale: CD4 less than 200 increases risk for pneumocystis jirovecii. TMPSMX is first-line prophylaxis. Strategy: use CD4 thresholds to guide opportunistic infection prophylaxis. Question 24. A 70-year-old postoperative patient with a history of DVT is on heparin infusion. APTT returns at 110 seconds, therapeutic range 60 to 80. The patient complains of increased bruising. What should the nurse do? A. Reduce heparin infusion rate and notify provider. B. Continue current infusion and recheck APTT in 6 hours. C. Give protamine sulfate immediately. D. Stop heparin and start warfarin. Answer: A. Reduce heparin infusion rate and notify provider. Rationale: APTT above therapeutic but not massive, adjust infusion per protocol and notify provider. Strategy: follow institutional heparin protocols for APTT-guided dosing and bleeding assessment. Question 25. A 50-year-old post-op patient has sudden onset of left-sided weakness and slurred speech. CT scan is pending. What is the nurse's priority? A. Assess blood glucose immediately. B. Administer aspirin stat. C. Elevate head of bed to 90 degrees. D. Obtain blood cultures. Answer: A. Assess blood glucose immediately. Rationale: hypo or hyperglycemia can mimic stroke, correctable causes should be ruled out immediately. Strategy: in suspected stroke, rule out hypoglycemia first, then maintain airway and await imaging. Question 26. A 30-year-old woman with severe preeclampsia on magnesium sulfate has respiratory rate 8 per minute, urine output 15 milliliters per hour, and absent deep tendon reflexes. What is the nurse's first action? A. Discontinue magnesium sulfate and call the provider. B. Administer a bolus of 4 fluids. C. Give furosemide 4. D. Increase magnesium infusion rate. Answer: A. Discontinue magnesium sulfate and call the provider. Rationale: signs indicate magnesium toxicity, respiratory depression, oliguria, absent reflexes. Stop infusion and treat with calcium gluconate per orders. Strategy: monitor respirations, reflexes, and urine output frequently during magnesium therapy. Question 27. A patient with suspected meningococcal meningitis is placed on droplet precautions. The family asks why they must wear masks. Which response is best? A. Masks are required because the infection spreads through droplets. B. You only need to wear gloves, masks aren't necessary. C. Wearing masks is optional but recommended. D. Masks protect you from airborne spores. Answer: A. Masks are required because the infection spreads through droplets. Rationale: meningococcal disease spreads via respiratory droplets. Droplet precautions, mask within 3 feet, are required. Strategy: provide clear, factual education about transmission and precautions. Question 28. A 66-year-old with chronic heart failure is taking digoxin. He reports visual halos and nausea. Heart rate is 48 bpm. What should the nurse suspect and do? A. Signs of digoxin toxicity, hold dose and notify provider. B. Normal side effects, continue medication. C. Allergic reaction, administer antihistamine. D. Electrolyte imbalance, give oral potassium. Answer: A. Signs of digoxin toxicity, hold dose and notify provider. Rationale: visual disturbances, GI symptoms, and bradycardia suggest digoxin toxicity, withhold and notify provider. Strategy: monitor digoxin levels, electrolytes, K+, Mg2+, and heart rate. Question 29. A 22-year-old in labor is given oxytocin infusion. Continuous fetal monitor shows late decelerations with each contraction. What is the nurse's priority action? A. Stop the oxytocin infusion immediately. B. Increase oxytocin rate to speed labor. C. Administer terbutaline to slow contractions. D. Turn off monitor and re-evaluate in 15 minutes. Answer: A. Stop the oxytocin infusion immediately. Rationale: late decelerations indicate uteroplacental insufficiency, stop uterotonic agents and initiate intrauterine resuscitation. Strategy: when fetal distress occurs with oxytocin, stop oxytocin, reposition, give oxygen, and notify provider. Question 30. A 58-year-old with acute stroke is started on alteplase, TPA. Door-to-needle time is achieved. 2 hours later, BP is 210/120 mmHg. What should the nurse do first? A. Give antihypertensive medication per stroke protocol. B. Increase 4 fluids to lower BP. C. Continue monitoring only. D. Stop TPA infusion. Answer: A. Give antihypertensive medication per stroke protocol. Rationale: elevated BP increases risk of hemorrhagic conversion after TPA, manage per protocol to target BP. Strategy: follow stroke center BP protocols after thrombolysis, treat severe hypertension promptly. Question 31. A 44-year-old with COPD is on home oxygen at 2 liters per minute. On admission, the nurse finds him increasingly drowsy and his PaCO2 is elevated. What is the most appropriate action? A. Reduce oxygen flow rate and monitor closely. B. Increase oxygen to 6 liters per minute to improve saturation. C. Initiate CPAP immediately. D. Encourage pursed lip breathing only. Answer: A. Reduce oxygen flow rate and monitor closely. Rationale: COPD patients may retain CO2 with high oxygen concentrations, reduce flow to correct hypoventilation risk. Strategy: titrate oxygen to maintain target saturations, usually 88 to 92%, and monitor ABGs. Question 32. A postoperative patient has sudden bright red bleeding from the surgical site and BP 80/50 mmHg. What is the nurse's immediate action? A. Apply direct pressure and call for help. B. Change the dressing and document. C. Elevate the limb and administer analgesic. D. Place patient in Trendelenburg position only. Answer: A. Apply direct pressure and call for help. Rationale: active hemorrhage with hypotension requires immediate pressure to control bleeding and mobilize emergency help. Strategy: prioritize hemorrhage control and hemodynamic stabilization. Question 33. A 5-year-old with acute lymphoblastic leukemia is receiving chemotherapy and develops fever of 38.5 degrees Celsius and absolute neutrophil count, ANC, for 100 cells/mm superscript 3. Which action is highest priority? A. Start broad-spectrum 4 antibiotics immediately. B. Give acetaminophen and continue to observe. C. Send home with oral antibiotics. D. Delay chemotherapy and schedule follow-up. Answer: A. Start broad-spectrum 4 antibiotics immediately. Rationale: febrile neutropenia is an oncologic emergency, prompt 4 antibiotics reduce mortality. Strategy: treat fever plus neutropenia as medical emergency, obtain cultures and give 4 antibiotics within 1 hour. Question 34. A 29-year-old in the ED has tachycardia, hypotension, pruritus, and swollen lips after getting a contrast dye for CT. What is the nurse's immediate intervention? A. Administer epinephrine IM and call rapid response. B. Give oral antihistamine and observe. C. Place warm compresses on the injection site. D. Encourage deep breathing and sit up. Answer: A. Administer epinephrine IM and call rapid response. Rationale: symptoms indicate anaphylaxis, epinephrine is first-line treatment. Strategy: for contrast-induced anaphylaxis, act fast, epinephrine, airway support, and 4 fluids. Question 35. A patient with suspected compartment syndrome after tibial fracture reports severe pain out of proportion to exam and pain with passive stretch. What should the nurse do? A. Notify the surgeon immediately for fasciotomy. B. Elevate the extremity and apply ice. C. Administer oral analgesic and reassess in 30 minutes. D. Continue neurovascular checks every 4 hours. Answer: A. Notify the surgeon immediately for fasciotomy. Rationale: compartment syndrome is a surgical emergency, fasciotomy prevents ischemic injury. Strategy: recognize pain with passive stretch as early hallmark, act immediately. Question 36. A 63-year-old on warfarin has hematuria and 9.2 Indian rupees. The provider prescribes vitamin K and fresh frozen plasma, FFP. Which nursing action is correct? A. Administer vitamin K slowly for and prepare FFP transfusion. B. Give oral vitamin K only and discharge the patient. C. Hold all interventions, wait for INR to trend down. D. Start heparin infusion to bridge therapy. Answer: A. Administer vitamin K slowly for and prepare FFP transfusion. Rationale: significant bleeding with very high INR requires reversal with vitamin K and FFP to restore clotting factors quickly. Strategy: for major bleeding on warfarin, reverse anticoagulation promptly with vitamin K and blood products. Question 37. A patient with septic shock is hypotensive despite 2 large volume fluid boluses. Vasopressor norepinephrine is being titrated. Which parameter should the nurse monitor most closely? A. Hourly urine output and mean arterial pressure, MAP. B. Serum glucose every 12 hours. C. Respiratory rate only. D. Daily weight. Answer: A. Hourly urine output and mean arterial pressure, MAP. Rationale: urine output and MAP reflect perfusion and response to vasopressors. MAP goal is often greater than or equal to 65 mm of mercury. Strategy: in shock, monitor perfusion markers closely and titrate vasopressors per protocol. Question 38. A 45-year-old with acute alcohol withdrawal shows tremors, hallucinations, and BP 170/100 mmHg. Which intervention is priority? A. Administer benzodiazepine per SIWA protocol. B. Provide oral thiamine only. C. Encourage hydration and observation only. D. Start antipsychotic medication immediately. Answer: A. Administer benzodiazepine per SIWA protocol. Rationale: benzodiazepines prevent progression to delirium tremens and control autonomic hyperactivity. Strategy: use SIWA scoring to guide benzodiazepine dosing and prevent complications. Question 39. A 72-year-old with suspected C. difficile infection has profuse watery diarrhea and a creatinine rise. The provider orders contact precautions and oral vancomycin. Which nursing measure is most important to prevent spread? A. Strict hand washing with soap and water after care. B. Use alcohol hand sanitizer after patient contact. C. Remove gloves at doorway only. D. Limit fluids to reduce diarrhea. Answer: A. Strict hand washing with soap and water after care. Rationale: C. difficile spores are resistant to alcohol sanitizers. Soap and water hand washing removes spores. Strategy: combine contact precautions, environmental cleaning, and soap and water hand hygiene. Question 40. A newborn is born at 32 weeks gestation. Nurse notes poor tone, nasal flaring, and retractions. What is the priority nursing action? A. Initiate respiratory support, CPAP or ventilator, per neonatal protocols. B. Place the infant in a bassinet and observe. C. Encourage breastfeeding immediately. D. Administer routine vitamin K only. Answer: A. Initiate respiratory support, CPAP or ventilator, per neonatal protocols. Rationale: preterm infants commonly have respiratory distress due to surfactant deficiency. Support is priority. Strategy: for preterm newborns, assess and support airway/respiration first. Question 41. A 58-year-old with uncontrolled diabetes has a foot with black eschar, foul odor, and crepitus. The foot is warm and tender. What is the nurse's immediate concern? A. Necrotizing infection requiring emergency surgical debridement. B. Superficial cellulitis treatable with oral antibiotics. C. Fungal infection needing topical therapy. D. Venous insufficiency needing compression. Answer: A. Necrotizing infection requiring emergency surgical debridement. Rationale: crepitus, foul odor, and black eschar suggest gas gangrene/necrotizing infection, surgical emergency. Strategy: recognize signs of rapid tissue necrosis and escalate to surgical team immediately. Question 42. A patient with myasthenia gravis reports increased muscle weakness an hour after receiving scheduled pyridostigmine. Respiratory rate is 10 per minute and vital capacity decreased. What should the nurse suspect and do? A. Myasthenic crisis, prepare for possible intubation and notify provider. B. Cholinergic crisis, administer atropine immediately. C. Normal fluctuation, reassess in 2 hours. D. Anxiety, provide reassurance. Answer: A. Myasthenic crisis, prepare for possible intubation and notify provider. Rationale: worsening weakness and respiratory compromise indicate myasthenic crisis, insufficient acetylcholinesterase effect or disease worsening. Strategy: assess respiratory status, vital capacity, and be ready to support airway, differentiate from cholinergic crisis clinically and by history. Question 43. A 35-year-old with acute pancreatitis has calcium 6.8 mg per deciliter and reports muscle cramps and numbness. Which is the priority nursing action? A. Administer 4-calcium gluconate as ordered and monitor cardiac rhythm. B. Give oral calcium tablets and discharge home. C. Encourage increased dairy intake. D. Start diuretic therapy. Answer: A. Administer 4-calcium gluconate as ordered and monitor cardiac rhythm. Rationale: severe hypocalcemia with symptoms requires 4-calcium and cardiac monitoring. Strategy: correct electrolytes promptly and monitor ECG for arrhythmias. Question 44. A patient with possible acute angle closure glaucoma has severe eye pain, blurred vision, mid-dilated pupil, and headache. What action is highest priority? A. Prepare to administer topical and systemic medications to lower intraocular pressure and notify ophthalmology. B. Instill artificial tears and cool compresses. C. Schedule routine outpatient follow-up. D. Administer oral analgesic and discharge. Answer: A. Prepare to administer topical and systemic medications to lower intraocular pressure and notify ophthalmology. Rationale: acute angle closure glaucoma is an ophthalmic emergency to prevent permanent vision loss. Strategy: rapidly reduce intraocular pressure and involve specialists immediately. Question 45. A 21-year-old with severe depression is started on an SSRI. 2 weeks later, the patient appears anxious, agitated, with diaphoresis and tremor. What should the nurse assess for immediately? A. Symptoms of serotonin syndrome and notify provider if hyperreflexia or autonomic instability present. B. Noncompliance with medication. C. Need for increased dose of SSRI. D. Allergy to medication. Answer: A. Symptoms of serotonin syndrome and notify provider if hyperreflexia or autonomic instability present. Rationale: new agitation plus autonomic signs can indicate serotonin syndrome, especially if other serotonergic meds are involved. Strategy: assess medication interactions, neuromuscular signs, and act quickly if serotonin syndrome suspected. Question 46. A postoperative patient with bowel resection has absent bowel sounds and abdominal distension on postoperative day 2, but severe sharp abdominal pain and fever develop on day 3. What is the nurse's priority? A. Suspect anastomotic leak or peritonitis, notify surgeon immediately. B. Encourage ambulation and clear liquids. C. Administer stool softener. D. Apply abdominal binder for comfort. Answer: A. Suspect anastomotic leak or peritonitis, notify surgeon immediately. Rationale: new fever, severe pain, and distension after abdominal surgery suggest leak or infection, surgical emergency. Strategy: early detection of post-op complications and prompt surgical evaluation are critical. Question 47. A patient with suspected acute adrenal crisis has hypotension, abdominal pain, and hyperkalemia. The provider orders 4-hydrocortisone and fluids. What is the nurse's immediate action? A. Administer 4-hydrocortisone and isotonic fluids as ordered. B. Start oral fludrocortisone only. C. Give insulin and glucose for hyperkalemia only. D. Delay treatment until lab confirmation. Answer: A. Administer 4-hydrocortisone and isotonic fluids as ordered. Rationale: adrenal crisis is life-threatening. Corticosteroids and volume resuscitation are urgent treatments. Strategy: treat acute adrenal insufficiency promptly, labs can be drawn but do not delay therapy. Question 48. A 67-year-old with Parkinson's disease on levodopa/carbidopa reports acute onset of severe hallucinations and confusion after a new urinary anticholinergic was started. What should the nurse do first? A. Review medication list and notify prescriber about possible drug interaction. B. Restrain the patient for safety. C. Increase the dose of levodopa. D. Administer haloperidol IM. Answer: A. Review medication list and notify prescriber about possible drug interaction. Rationale: anticholinergics can exacerbate confusion and psychosis in Parkinson's patients, medication interaction likely. Strategy: always reconcile meds and consider interactions before adding new drugs in neurologic disorders. Question 49. A 55-year-old with suspected acute mesenteric ischemia presents with sudden severe abdominal pain but minimal exam findings. Lactate is elevated. Which action is most urgent? A. Notify the surgeon immediately for possible urgent intervention, angiography/surgery. B. Start oral analgesics and observe. C. Schedule elective imaging next week. D. Begin bowel regimen. Answer: A. Notify the surgeon immediately for possible urgent intervention, angiography/surgery. Rationale: mesenteric ischemia is time-sensitive, early intervention preserves bowel viability. Strategy: severe pain with minimal findings is a red flag, act quickly for vascular causes. Question 50. A patient in the ICU on mechanical ventilation has sudden high peak airway pressures, hypoxia, and absent breath sounds on the left. What is the nurse's immediate action? A. Assess for tension pneumothorax and prepare for needle decompression or chest tube placement. B. Increase ventilator tidal volume to overcome resistance. C. Suction the endotracheal tube only. D. Turn patient to left lateral decubitus position. Answer: A. Assess for tension pneumothorax and prepare for needle decompression or chest tube placement. Rationale: sudden high pressures, hypoxia, and absent breath sounds suggest pneumothorax, potentially tension physiology requiring immediate decompression. Strategy: in ventilated patients, rapid assessment and emergency decompression can be life-saving. You've just completed 50 of the most critical NCLEX case study questions, and if you made it this far, you're already one step closer to success. Now it's your turn. Tell me in the comments how many you got correct and which question challenged you the most. Don't forget to like, subscribe, and share this video with other nursing students preparing for NCLEX. Remember, consistency is the key to confidence. Keep practicing, keep reviewing, and I'll see you in the next video.